Hi guys, Dr. Charles Art here. I thought I'd tell you a little bit about what a disc herniation is. First of all, herniation is any type of protrusion of some other tissue from the body. In this case, we're talking about the disc and what actually protrudes out of it. A lot of people have heard, oh, I herniated a disc, I got this going on, I got a disc bulge, I got this. All those are terms for herniation, are all from different degrees, okay? We're going to discuss a little bit about that. One of the things you need to know is this. A lot of times, and this is over the 30 years I've been in practice, that people have pains in their back and they feel very, very stiff in the morning. That's not a good sign. You should be well rested, and when you get up in the morning, your body should feel good. When you feel stiffness, it means there's some type of degeneration and damage going on in your body that you may not be aware of. Now, another thing I need to explain something. Discs do not herniate on their own. Yes, you could have a trauma directly if you had an auto accident, maybe a herniation in the neck. But they typically do not occur on their own. They actually occur because there's some type of problem, postural problem, abnormality in the spine. You can imagine if a person's head was off to the side, they're going to slowly wear the tissues away. If they're always walking around like this, they're going to have a problem and it's going to start breaking down those tissues. So what actually happens? If we look at this, these are two different vertebrae, and they're big, so they're most likely low back vertebrae that I've designed here. This is the disc. There's a jelly inside. There's 90 to 110 layers on this outside that are very fibrous, very strong. If I cut this in half, that's what this would look like. And this is the back of the vertebrae with those little bumps you feel in the back. That's that little guy right here. These are little processes that actually attach muscles, and there's nerves that come out and go to the rest of your body, and this is a cut through of the disc. This is what I want to explain today, though. What happens, there's a jelly inside of here, all these fibers all the way around it. People always talk it like it's a jelly donut. It's not a jelly donut. That jelly inside is a liquid. It does not compress. You can't compress it. So it's not like a shock absorber. The actual nutrients get from the vertebrae above and below. It's the movement that allows the nutrition to get into the tissue because there's no blood flow at all to this area. These fibers are very, very pain sensitive. If you cause problems in it, that's where you're going to get the stiffness and pain. With abnormal movement, you can start getting tears in these fibers. So if we get tears like this, you can start getting little radial tears. Now when you get those tears, this fluid, this gelatinous type material starts pushing out, and you can start getting bulging of this area out here. Okay? So it's not all continuous. It's actually getting a big type bulge here. Now why is that bad? You've got nerves back here. And so when we start putting pressure on that nerve, you're going to start getting problems down that nerve. You may get some butt pain. You may get some pain down the leg. Not a good situation. Okay? And this will keep going. Oops. This will keep going. You can get to a point where this jelly will actually come out and sit inside this canal. Not a great situation either, okay? There are different resolves for this area. The biggest thing is preventing it, which actually happens with good posture, good movement of the spine, okay? We do have a lot of patients come into our office that are in a situation like this, where we have a device called SpineMed. It's a decompression machine that's been shown. We can pull this back towards the center and letting these tissues heal again, okay? And getting it pulled away. Getting this pulled away from that nerve. That's what was called SpineMed. So the solution is this, okay? One is keeping your spine in good shape, meaning it's moving properly and it's in good position, meaning you have normal posture. The second thing is if you're having any type of stiffness or in the morning, that's not a good sign. One more thing I want to be able to bring up. Most people, when they're having problems with their back and they're having disc problems, there's a couple different things I want you to be aware of, okay? One is that it's a pressure situation. So if you're lying down, there's very little pressure on the discs, and there's very little pressure pushing this out, okay? That's a good thing. When you sit, there's a certain amount of pressure in there, but when you get up from sitting, it is very high, and it can push this out even more so and cause more damage. Probably seen people walking up, getting up like this. Not a good sign either, okay? Definitely in a situation like this, you do not want to say, hey, I got to build up my core and start doing sit-ups. that actually is through the roof pressure, and it's going to cause more harm than good, okay? And we'll see you next time.